So we're gonna do what's called instrument-assisted soft tissue mobilization. There are many techniques of this. A very popular one's called Graston, where you use a specialized stainless steel tool with these different bevels and edges on them to help massage the tissue. Now, this is a little more intense and is a little more aggravating, especially to fresh injured tissue, and it can be uncomfortable for the patient. So you really do need to use more of the lotion and more of the oil or whatever you may be using to help reduce skin friction. We're not trying to cause bruising. We're not trying to cause that little like hemorrhaging that you see. It can be so common from a massage or like a little bruising. We're not trying to do that. It does happen often, and sometimes that can happen just because you have too much friction on the skin and it's breaking the little capillaries near the skin. So what we're gonna do, you can see this tool right here. It's a nice big sweeping tool. We're gonna use it on the leg. Again, we're sweeping up towards the heart. We're trying to basically break things up in this area, get it to go back in that venous and lymphatic system and go pump up towards the heart. So I'm not going down towards the leg, I'm going up towards the heart. Also, you can kind of see on this, there's a bevel, so like a actual edge. You want to go in the direction of that bevel. So I wouldn't hit this flat end back here. I'm going to use this sharper edge on this one side. Realistically, this thing's pretty heavy. It's honestly about 2.5 pounds, just pretty heavy bar. So I don't need to push that hard. I'm gonna let the tool do a lot of the work, which actually saves your hands, because your hands are your most important tool in massage. So these tools can be really a helpful adjunct for that. So I'm gonna take it here and just kind of go a nice sweeping strokes. And what I'm doing is I'm feeling through the bar. I'm feeling how the tissue moves underneath it. And I can feel like when I go right there, I feel a little spot where I drop off, almost like a speed bump. And so I can tell there's some restriction there. And if you look at the leg, there's already some increased blood flow, right? This is getting red, it's getting, we know that it's starting to work in that area. I don't need to like dig and press super hard. This tool will do enough of the work. It's really light strokes, about 15 to 30 strokes up in one direction. You can kind of go off to the side where you're no longer, again, going cross friction. You're not going straight in line with the muscle. You can go down as well, depending on what you're doing. Certain injuries are okay with that. We're not going to start with that, right? So I could come back this direction, but we don't always need to do that. I know I just said that we want to go in the direction of the heart. It's typically where we start is going up in the direction of the heart. And everything we end with, which we'll go over in just a minute, will always be up towards the heart. So this is instrument-assisted soft tissue mobilization. Really, really helpful for upper neck issues as well along the shoulder. But again, you can see how much already there's increase of blood flow here just from a few strokes. And so this really is an effective method to help reduce pain, increase blood flow, and increase the function of the muscle.